Thanks, Ruth, and thanks to everyone for joining and offering your time to volunteer with us. As Ruth said, I'm Ashley. I'm one of the nurses with Employee Health, and one of our jobs is to medically clear all the onboarding volunteers at Sinai. I wanted to point out a few things on this volunteer clearance form that will help expedite things for you guys, a few tips, if you will. So the clearance form itself is 2 pages and it's points 1 through 8 that need to be completed by your primary care doctor, a nurse practitioner, physician assistant. So point number 1, physical exam, pretty self-explanatory. Just the date needs to be written in there and it has to be within the last year. Number 2, the tuberculosis testing. I wanted to point out this because there's a lot of wording here and it can get confusing, I know. So for the TB testing, you have 2 options. You can do a TST or tuberculin skin test option. 2 are required. It's TST number 1, TST number 2, and the time frame requirements for these are to the right in parentheses. So those are that's what you want to pay attention to there. The other option you can do if you don't want to do the skin test or if your doctor doesn't recommend that, most people prefer this option is the QuantiFERON Gold. It is a blood test and it's much quicker. The skin tests are more time consuming to complete. And again, the time frame requirements is to the right. It's within 3 months of your anticipated start date. If you have a history of a positive skin test or positive QuantiFERON Gold blood test in the past in your lifetime, that is an abnormal result being positive. Then you want to do the chest x-ray option. The chest x-ray has to be within the last year, and you must attach the chest x-ray radiology report to this health clearance form. That's a special circumstance. See if that applies to you, but I wanted to point that out. Number 3 and 4, measles, mumps, rubella, and varicella. It is the same. So it is either 2 vaccines in your lifetime for each, or you can choose to do the antibody blood test to check for antibody levels. Number 5, hepatitis B. You have 3 options there as it reads. You can submit documentation of the completed Hep B vaccine series or a positive titer, which is the antibody blood test that shows immunity. Or you can sign a declination. And if you want to sign the declination, Ruth will provide you with our email address and you can request this and me or another nurse will send it to you. Hepatitis B immunity showing this is optional. We do recommend it always for everyone, but it is optional. Hepatitis B is spread blood and bodily fluids. So for example, a volunteer who's in the emergency room, we more highly recommend it than say, for example, someone who's doing more administrative type of tasks. Those volunteers have, opted to decline in the past. So again, the choice is yours. Influenza, you must have a flu vaccine, all on-site and hybrid volunteers. It is required. There are no exemptions for this in any way. So please provide the most recent, most up-to-date flu shot for the 24 to 25 season. Tetanus vaccine, that must be within the last 10 years. And number 8, a lot of people miss this question. If you have a chance to review your health form before uploading it, please make sure this question is answered by your provider because it is required. I will also note that this health form cannot be bypassed. It must be done. If you upload just your immunization records, we will not review it until this health form is submitted. This health form, this 2-pager here, it must be done. It must be at the bottom here, signed, stamped, and dated by your doctor, nurse practitioner, physician assistant, as I said. It can be a primary care office. It can be a local urgent care, such as CityMD, MedRite, CVS Minute Clinic. All those places have filled out our health form for past volunteers. So it does not have to be a primary care doctor specifically. And last thing I do want to note is if you are doing any blood tests, please be sure to attach the lab reports of the blood test to this volunteer clearance form. And then we will review it and we'll email you if anything is missing in terms of the medical clearance. All right, I think that's it. I'm going to hand it back to Ruth. Thanks, everyone.
Thank you, Ashley, for all the helpful tips on how to complete the health form.